Well, there are a number of disease-specific World Health Days, and today is World Hepatitis Day. Today, people all over are raising awareness of viral hepatitis. And here to talk more about prevention and treatment, Dr. Richard Gilroy, the Director of Hepatology and Liver Transplant at Intermountain Medical Center. Dr. Gilroy, thanks for being with us today.
Thank you for having me here.
Let's start first with what is hepatitis and how does someone contract it?
So the type of hepatitis we're talking about here are viruses.
Okay.
How do you get viruses? Well, you may be exposed to viruses through parenteral exposure, meaning needles or injections or transfusions. However, there's important populations that need to be screened because they developed hepatitis when they were born.
So you can be born with this type of hepatitis.
Correct. So if we look at the population of Utah, about 40,000 people are of Polynesian descent. They have a high frequency of hepatitis B. And they should be screened once to see if they have the virus, and if it is present, there are cures available. Similarly, when we look at the Asian population, higher frequency if they were born in Asia for hepatitis B and hepatitis C, and screening there. And the most important population, the baby boomers, people born between 1945 and 1965. And what do we know? Only half of those people have been looked at in the Utah state for the potential of having this disease. So we only know half of the people we could cure.
Interesting. So, we only know half. How big of a population is this that should be screened, do you think, here along the Wasatch Front?
If you look at the Wasatch Front, you're looking at the people with the baby boomer generation, which is going to be about a third of your population. Of those people, it's not whether you're at risk, it's whether or not you've been screened. And so it's a one-time blood test for hepatitis C. The population itself, only 3 to 4% may have hepatitis C. And these people, if identified with it, can be cured with the new therapies that cure nearly 100% of people.
Let's talk about some. If you've turned up positive for B or C, what are some of the options out there?
So the options that we have are the new medications that everyone's seen in the paper. They can be categorized as expensive, but at the same time, as compared to what we used to do, they cure people. And this is critically important. My partner, Michael Charlton, myself, we have many research protocols that treat people and cure them of this disease. And with hepatitis B, which is common in the Polynesian population, we have now new therapies and new treatments that are coming around that will cure people of that disease.
Wow, that's amazing. In terms of symptoms, do they need to be treated or tested even if there's no symptoms? And what are the symptoms?
More often than not, people aren't symptomatic. And it's when they're asymptomatic that you can provide them a prevention from developing cirrhosis. If you don't treat them before they get cirrhosis, then you increase their risk of dying. The third most common cause of cancer-related death in the world is hepatocellular carcinoma. 90% of those people who have HCC because of hepatitis B. Cure B, prevent cancer.
That's amazing. Where can someone go for more information?
More information can be attained. 1, your primary care physician can screen you. 2, the Intermountain Medical Center has the opportunity to see you. Anyone who has concerns about that could go through that to be screened. There are many organizations that will help with treatment if you're identified with having the problem. Most importantly, we cure people before they become people needing liver transplants.
An easy blood test can save your life.
Correct.
All right, Dr. Gilroy, thanks so much for being here today.
Thank you very much.